All right, started your timer, and here is your question. Right. So if you have read and understood considering 8 procedural skill station, kindly tell me how would you prefer to prioritize the following patients for operation theater listing?
Yes, I would like to post the first case as the strangulated inguinal hernia with COPD and pacemaker. Then second, I would post the diverticular abscess. And third one would be the MRCA positive patient with diabetes with who needs below-knee amputation.
So you mean to say you'll keep the listing as it is?
Yes, ma'am.
Yes.
Yes.
Okay. Can you tell me why you have placed strangulated inguinal hernia with the COPD and pacemaker as number 1?
Yes, ma'am. Out of these three cases, the urgent case is strangulated inguinal hernia according to the National Confidential Inquiry of Patient Outcome and Death Classification.
Yes.
So I would like to post that one first. And
So what is the
the
criteria according to that for emergency surgery?
yes, if it is a threat to the organ or life,
Yes.
then it is an emergency surgery.
And it
And
should be operated immediately. Yes. And what else?
yes, then if it is an urgent surgery, it is not an immediate. It is not a threat to the urgent surgery is the condition threatens the life or limb or organ survival, but it can be operated within hours after the resuscitation is complete. For example, it can be a perforated bowel with peritonitis or open fracture fixation, debridement and fixation. Then we have expedited surgery where the patient is stable and there is no threat to the life or the limb.
Okay.
And but early surgery is preferable, such as repair of tendons and nerves. Then we have elective surgery, which are pre-planned and done electively in the
All
operation
right.
theater, such as
Can you
a
please
laparoscopy.
tell me what are the recent current guidelines for perioperative glycemic control for diabetic patients?
Yes, the diabetic patients don't need regular overnight admission before the surgery, and they uh, they should not be kept nil by mouth for more than one meal, and they should be prioritized in the
Operating
list
list.
of
Yes.
operating.
But you have decided to keep this patient for number 3. Yes. Can you explain why? Won't be
Yes,
patient starving a lot? Yes.
yes. Here, the as the patient is having maybe a diabetic foot, which is
Yes.
a contaminated or a dirty surgery, and also the patient is
Because
having
of,
MRSA
yes.
infection.
Yes. Yes.
So I want to avoid cross infection to other patients.
Yes.
So I've posted the patient last, but as the patient is diabetic, um, there is it should be posted first. But here, as there is infection, I am posting it last, and the patient will be put on insulin. Can be put on insulin infusion with IV fluids in the meanwhile till he's operated.
When it comes to children, how would you prioritize them for
Children should be
surgery? Yes.
children should be prioritized early to minimize the distress uh, to the
Of the child,
child,
yes.
and to the decrease the worrying of the parents.
All right. Patient, one of the patient, the first patient also has COPD and pacemaker. What advice would you give to the operating personnel or operating staff?
Yes, if the patient is having a COPD, then there is increased risk of respiratory complications, including respiratory failure. So uh, there should be facilities for resuscitation in the operation theater, and
Can you
the
mention two complications that can post-operatively occur in patient with COPD?
is there can be atelectasis
Very
and
good.
pneumonia
Or
and
respiratory failure. Yes.
respiratory.
How could this be reduced
Yes, the patient.
post-operatively?
Yes, starting pre-operatively, we have to advise the patient to stop smoking and consult the general practitioner of the patient to see what medications he's taking and optimize the medications of the patient. And uh, uh, we can advise the pre-operatively and post-operatively physiotherapy, chest physiotherapy, including incentive spirometry, and adequate pain relief so that the patient can cough up easily, and also upright position after the surgery. And wherever possible, general anesthesia should be avoided, and the surgery can should be done under regional or local anesthesia. And also, if laparoscopic surgeries should be avoided.
Yes. And COPD patient or also taking or using steroids. So how would that affect patient's surgery and post-operative care? Why
Yes,
is it
steroid.
important? Yes, for the surgeons to know.
Yes, if the patient is taking on steroids, then we have to increase the dosage of steroids
Yes, very good.
during the surgery
In order to
to
prevent
manage the
additional. Yes.
to deal with the stress response. And also the patient might have increased delayed wound healing, and increased chances of infection because of the steroid intake.
All right. Can you tell me what advice or what advice would you give to the operating surgeons since the patient has pacemaker?
Pacemaker, the preoperatively the pacemaker check should be done, whereby the patient should be reviewed in the pacemaker clinic to check the dependency of the pacemaker, and for any advice to the surgeon from the pacemaker clinic. Then
INR should be kept at what level?
INR should be maintained between 2 to 3, I think.
Yes, between 1 to 4. Yes. And what kind of,
Uh, Sorry.
what else can they should keep
Yes.
in their mind?
The uh, the
Advice with
intraoperatively
warfarin, yes. And in during, yes, intraoperatively.
intraoperatively the monopolar cautery should be avoided,
Very good. Should be avoided. All right.
and
If a patient is allergic to iodine, how would you or what would you arrange or what would you make sure a patient gets?
chlorhexidine based solutions can be used for as antiseptic if the
And
patient is allergic to
also,
iodine.
if any patient is dependent to penicillin, what medication
If
can be used other than
uh,
penicillin?
then vancomycin, erythromycin, and
Yes,
cephalosporin,
good,
uh,
very
cefazolin
good.
can be used.
Yes, this was it. And what kind of, if you can tell me, what kind of insulin infusion or what kind of uh, maintenance fluid can be given to the to the patient, to the diabetic
Yes,
patient? I'm
to
sorry.
the diabetic patients, they should be given 0.45% normal saline with 5% dextrose with
Yes.
added potassium 0.15 or 0.3% potassium.
Okay. What should be your target blood glucose level?
The target blood glucose should be between 6 to 10 millimoles,
Yes.
uh, moles per liter.
Okay. Right. Small things you can maybe add when I was asking you for the pacemaker, that routine ECG should be taken or monitored.
Yes,
Right. Diathermy you've already told me, and about the warfarin that patient is using.
yes, ma'am. If the pacemaker patient is on, uh, wa- I have a doubt, ma'am. Do these pacemaker patients, are they on warfarin?
Yes,
Okay.
because they have to give thromboembolic something. So most of the time, that's what they are getting. If they are not getting, because it's not possible to give them that injectables all the time. So
Yes. So okay. So we stop the warfarin 5 days before and
yes,
start. Right? Okay.
during that time you'll be giving them injections, and then afterwards you have to manage the INR and then start warfarin again.
Okay.
Good. Thank you.